In the fascinating world of medical procedures, there's one that stands out for its elegance and precision: laparoscopic cholecystectomy. A term that may sound complex, but can be broken down into simpler words. Laparo refers to the abdomen, cholecyst to the gallbladder, and ectomy means removal. So in essence, laparoscopic cholecystectomy is a minimally invasive surgical procedure to remove the gallbladder. Imagine a skilled surgeon armed with a laparoscope, a slender tool equipped with a tiny video camera and light at the end. This is not a scene from a futuristic movie, but a modern-day operating room where laparoscopic cholecystectomy is performed. The procedure commences with the administration of general anesthesia. As the patient drifts into a peaceful slumber, the surgical team prepares for the task ahead. The surgeon makes a small incision, about a ½ inch long, near the belly button. This is the entry point for the laparoscope, the surgeon's eyes inside the patient's body. Next, the abdomen is inflated with carbon dioxide, a harmless gas that creates a clear, unobstructed view of the internal organs. The laparoscope, now inside the body, transmits high-resolution images to a monitor in the operating room. This gives the surgeon a magnified view of the gallbladder and surrounding anatomy. The surgeon then makes 3 or 4 additional small incisions in the abdomen. Through these, specialized surgical instruments are introduced. These instruments, guided by the images on the monitor, are used to delicately separate the gallbladder from its attachments. Once the gallbladder is free, it's carefully removed through one of the small incisions. After the gallbladder is out, the surgeon checks the area for any potential complications. If everything looks good, the instruments are removed, the carbon dioxide is released, and the incisions are closed with sutures or staples. After the surgery, the patient usually spends a few hours in recovery before being sent home, with the entire procedure typically taking about 1 to 2 hours. The recovery time at home can vary, but most people can return to their normal activities within a week or 2. So, what have we learned about laparoscopic cholecystectomy? It's a minimally invasive procedure to remove the gallbladder. It uses a laparoscope and other specialized instruments introduced into the body through small incisions. The procedure is typically completed in 1 to 2 hours, and recovery at home usually takes a week or 2. It's a testament to the power of medical science, a procedure that combines precision, efficiency, and minimal discomfort to help patients get back on their feet as quickly as possible. Laparoscopic cholecystectomy, a shining example of modern surgical techniques.